Thank you. So when I was 19, I was in Montreal. I was an undergrad student, and I managed to get sick with the flu. So I sat down and I Googled, is flu going to kill me? And Google brought up Wikipedia. Wikipedia said no, so I stayed at home for 3 days eating my typical diet of ramen and water, and didn't get better. So I decided to go to the hospital. Now, has anyone here been to a hospital or an emergency room? Raise of hands. So who thought it was a really good use of their time? Very efficient, right? Yeah, I didn't have such a good time either, so I waited for about 8 hours in the emergency room. A nurse came to me, a doctor came to me. They spent maybe 4 minutes with me. The doctor was typing away on the computer, and they sent me home with Tylenol for rest and relaxation. So now, fast forward about 15, 16 years, I'm on the other side of the table. Most of my time is spent diagnosing disease, figuring out, the treatment options, documenting, and admitting people to the hospital and sending them home. So I want to give you some perspective today on how we use AI in the hospital system, and some of the exciting things about AI, but also some of the potential challenges that we face. So what is AI? There's a lot of answers to this question, but most people would say it's artificial or augmented intelligence. We say augmented to get away from this idea that it's going to replace human beings or replace human intelligence. It's more about augmenting. It's an umbrella term, so generally the definitions include some ability to perform tasks attributed to intelligent beings with some degree of autonomy using data and pattern recognition. It includes technologies like machine learning, natural language processing, and large language models, the most famous of which is right now ChatGPT, which you've probably all heard of at this point. Has anyone seen this graph? Raise of hands. Some people. So I really like this graph, and what it shows is, this is called the Gartner hype cycle. Typically, there's some sort of technological breakthrough or trigger, and suddenly we have expectations. Expectations that that technology is going to solve all of our problems, cure cancer, everything, that we can think of. And the results start coming out. The first iterations of technology starts coming out, and we realize that, maybe it's not as good as we thought it was. And we start going through this trough of disillusionment. Eventually, we get second and third versions of these technologies, and we start to become productive with the technology. So AI is all over the map when it comes to this graph. In some ways, when it comes to image recognition, it's on the plateau of productivity already. In other ways, when it comes to, for example, treating disease or behavioral health, we're still very much somewhere between inflated expectations and disillusionment. So why do we really care? Why do we care about AI in healthcare? Well, number one, there is a lot of information. This is a graph that shows how many journal articles get published decade by decade in cardiology alone, and you can see it's just an exponential curve. And what information consumes is the attention of the recipients. So a wealth of information creates a poverty of attention and a need to allocate that attention efficiently. Has anyone seen this picture before? This is a really famous picture, 2012 it was published, and on the right side, I don't know if you can see it, but there's a child, a 9-year-old child. This is a clinician's office, and their family surrounding the child. And on the very left side, that's the physician staring at his or her computer. And this is the recollection that that 9-year-old had of that entire encounter. So I think that's a very powerful image. And let's talk costs for a second. In healthcare in the US, 20% of all costs are considered wasteful. as we really didn't have to spend that money. 15% of all costs are related to billing and talking to insurance companies in the US. 12% have to do with administrative complexity. And in the US, we spend about 5 times as much time just interacting with payers. And when I say payers, I mean insurance companies, compared to Canada. So these are some of the reasons we care about AI. And these are some of the solutions that have already been brought up. So we can use AI to diagnose better, right? So this is Google Lens, where you can take a picture, in this example of a skin lesion, and it can give you diagnoses. This is becoming really, really good, especially when it comes to image recognition. We can decrease documentation burden. So as I mentioned, a lot of time is spent on administrative time. So the idea is you can bring your phone into the patient's room, record the conversation, and the AI system will write your note automatically, so that doctor doesn't have to be staring at their computer typing while they're talking to you. They can actually be listening to you. We can answer concerns by having the AI system generate draft responses and then edit them, which I think can be a pro or a con. And we can have a better flow through the hospital system. And AI software can triage symptoms and allocate resources before the patient even gets to the hospital. We can help with registration, triage, even once someone is admitted to the hospital, to prognosticate, to figure out how sick they are, and to catch deterioration early. So these are some of the reasons to use AI. We can shift the workload from administrative care to actual patient-facing care. We can have the right information at the right time for the right patient. We can have more engaging patient-centric care. And we can recognize patterns that are really difficult for human beings to see in the data. But we do have some challenges. There's already a lot of bias against AI advice. So it's a busy slide, but what these researchers did is they took medical advice, and the same advice they labeled as Dr. So-and-so, human. They labeled it as AI generated, and they labeled it as Dr. So-and-so with AI help. And across the board, people typically said that they found the AI-labeled advice less reliable, less empathetic, and they were less willing to follow the advice. Now, I will say, if you repeat this study year after year, you might get different results because culture shifts happen. There are big questions that come up when we talk about AI in medicine. Who actually owns the data that's being used to train these models? Is it the patients? Is it the companies that have collected this data? What happens when they're wrong, right? If your doctor tells you you shouldn't get chemotherapy for your cancer because their AI model says that it's not going to work, and it's wrong, who do you sue? Do you sue the doctor? Do you sue the clinic? Do you sue the software company that made the model? We don't really have a lot of legal precedents to this stuff right now. And then there's this concept of how do we trust manual processes that we rely on? So imagine for a second if you're reading a paper, a medical paper, and the researcher used AI to write that paper, which is not hard to do, and the editor used AI to review that paper. So the peer review process can become basically an AI arms race at some point, right? So we can lose trust in these manual processes that we have. There are power shifts and authority shifts with AI where the faculty is being hired away from universities and towards private industry because they pay better, they have access to the computing power and the data sets. And they tend to eliminate their ethics teams because they cite friction that would slow the company down. There's also bias built into AI. So I asked ChatGPT, the lead engineer, Engineer Smith, thinks that the project will finish on time. And I have full trust in his expertise and leadership. But then I asked, write a review on Nurse Smith, and ChatGPT assumed Nurse Smith was a female. And there are many sources of bias, from problem selection, so which problems do we study in medicine? We tend to study the ones that are well-funded, but the funding comes from typically Western sources, and so that can be biased. How do we collect the data? Do we just collect data from people that show up at the hospital? Because not everyone shows up to the hospital, etc. And so I'd just like to leave you with a future vision here. So imagine that you're sitting at home. You have a smartwatch on, which has an AI system built in. You get chest pain. The smartwatch knows that you have a history of smoking, and it has your health information. And detecting that your heart rate is elevated, it asks you if you're okay. You say, no, I have chest pain, and it asks you if you want to alert the emergency medical system. You can alert and activate the medical system right from something like your watch. The watch can send live vital information to the ambulance, who can have the right people with the right medications arrive at your door, and they can send their information to the hospital, who can then have the right medications and a room available for you, so you're not waiting with a heart attack in the emergency room. This is the kind of thing that AI can really help us with and help make that interaction with the hospital system better. And it's very exciting. But I think it's up to us to make sure that we use AI responsibly and that it shapes the world in a way that ultimately benefits us. So that's my talk. Thank you.